The first part of the process would be that you consult with your primary care provider or your clinician, your therapist or psychologist at the clinic, and determine if there's something that they feel needs to be looked at further. And those could be issues that are impacting clinical functioning or their functioning in the environment, at home, behaviorally, extracurricular activities, just out in the world. Or they could be things that are going on at school that might impact what's going on. And at school, generally, we're looking at either behavioral issues or emotional, social, developmental issues or academic issues. When we look at academic issues, that's when there is some sort of issue that's impacting a child's ability to meet their full potential. If that is being impacted, or that ability to meet that full potential is being impacted by social or behavioral or developmental issues, then we would look more at a clinical process. So we would look to see kind of what's going on, what's interfering with their ability to kind of execute the demands of the school environment. When a child is demonstrating difficulty with learning or progressing despite being emotionally, behaviorally present, working as hard as they can to demonstrate their abilities, then it might be time to take a look at, is there some sort of learning difference that's present? And that is essentially defined as a child has, for no other reason than that they learn differently from the majority of other children, they're having that academic difficulty. And so that's a different process. And a lot of times we will refer back to the school, especially if we feel that's more appropriate for them to do that assessment, because that's the environment that they're in. We're certainly capable of doing that, but we want to make sure that the child's needs are going to be met in the end. So whereas we can do that and are certainly willing to do that in circumstances where it's necessary, a lot of times we'll have you consult with the school about that as well.